Hi, I'm Dr. Randy Martin. I'm here at the AATS Mitral Conclave 2017. I'm really pleased to be joined by one of the giants in the field of mitral surgery, Professor Ottavio Alfieri. Thanks so much for joining me, Ottavio.
Oh, thank you for inviting me.
You've been a pioneer really in this whole field, obviously with the procedure that you popularized and helped so many patients with. Where do you think we stand right now with the philosophical approach? Sounds funny, philosophical approach to mitral valve reconstruction.
You know, the mitral valve reconstruction has been a successful story all over the year. Since the very beginning, it was very clear that it was very much superior to valve replacement.
Right.
So the current philosophy is to use mitral valve repair in as many patients as possible, as far as the procedure can be durable over time and guarantee a normal quality and length of life.
That's great. How do you define durability? That's difficult, I know. But I mean, it's difficult. Is durability defined by coaptation and lack of mitral regurgitation soon after the procedure? Or?
Exactly. If you do the repair properly and you can obtain a good coaptation length at the end of the repair, the probability of a long-term durability is very high. This can be considered a definitive operation in life, and you don't have to do anything more after that operation.
That's great. So I know many people know it, but a lot of people don't know it. How did you come up with your approach for the now known Alfieri stitch?
You know, I thought at that time when I started at the beginning of the 90s, that there were categories of patients in whom it was very difficult to have an optimal repair.
Right.
And so that particular technique, the edge-to-edge technique, was designed with the purpose of improving the results in that category of patients, namely patients with the anterior leaflet prolapse, with bileaflet prolapse, patients with calcification, with the erosions and so on.
Right.
These difficult kind of patients are properly treated with that type of repair.
It's fabulous, which makes me transition into the world of transcatheter approach to mitral valve repair now.
As a matter of fact, the edge-to-edge repair was a very good technique to be reproduced by the catheter technology.
Right.
And this is the reason why currently is probably the only technique which is considered valid for transcatheter mitral valve repair. As a matter of fact, more than 40,000 patients have been treated around the world with the mitral clip procedure, which is exactly reproducing the stitch connecting both leaflets.
And I'm going to continue that, but just a thought came to me. In your original work, you did some kind of annular procedure as well. So the thoughts always come up in the clip patients or in patients who would have a leaflet only. Do we need to have some kind of, in certain patients, an annular approach as well?
You are right. If you don't put the ring, probably the results are going to be worse over time. But you have to consider that the mitral clip procedure is currently applied in patients who are very sick, very old, and so the very long-term survival is not so important.
You were also ahead of your time when you encouraged some of your colleagues, Francisco comes to mind, to become engaged in the transcatheter approach as surgeons. Is that the right model for the future, do you think?
I think that it's going to take some time, but the direction is toward transcatheter procedures because that is natural. You have seen what happened for the aortic valve, and it's going to happen for the mitral valve as well. Of course, the process is going to be a little bit slower, but it will come.
That's interesting. If you put your futurist hat on, where do we stand in 10 years in mitral valve therapies? Is it going to be the majority transcatheter, or is it going to, it won't be like aortic, I don't think.
We have data which are really astonishing from Germany. In Germany, in the last 2 years, the mitral clip procedure was numerically much more superior in comparison to surgical mitral valve repair.
Interesting.
This, it was hard for me to believe that, but
Right.
this is true. So this is the direction. It's going to take a little bit more time. Reimbursement is a very important factor affecting that. In Germany, there's practically no restriction in reimbursement,
Right.
and this is what is happening. You have to consider also that the mitral clip procedure is not alone. There are other percutaneous methods coming up. For instance, the methods reproducing the surgical annuloplasty.
Right.
And the combination of the mitral clip with annuloplasty will result in a fully percutaneous mitral valve repair.
What about replacement? Transcatheter mitral valve replacement?
Certainly, mitral valve replacement is at the very beginning, actually, because
It's complex.
is complex. There are many difficulties. It's not like an aortic valve replacement.
Right.
And certainly this process will be much slower, but that will come. And there will be maybe in the future a competition between transcatheter mitral valve replacement and repair.
Interesting.
In our opinion, these two procedures are going to be complementary. So there will be some patient good for repair and some other good for replacement.
So you've educated us, and I really enjoyed talking to you as always. Thank you very much for joining us.
Okay, it was a pleasure. Thank you, Randy.
Thank you.
Okay.
And thank you, and we hope that you'll come back soon.